Hello and welcome to the Headache Doctor podcast, where on this podcast, it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. So that all starts with understanding the source of your symptoms. You see, if we don't understand the source of your symptoms, then we really don't know what to treat. We can manipulate your pain signals. We can drown out pain signals. We can lower the volume, the intensity, maybe the frequency, but ultimately the signal is still going to be there because the problem is still there. In our healthcare system, people go through provider after provider looking for the source of their symptoms, and they don't find the answers that they're looking for. They feel hopeless, they feel burnt out, they feel fatigued, and they feel like there's never going to be an answer. When we start talking to people, as you heard in Amanda's in her story, going through our process, she felt really guarded. She didn't want to move forward. She didn't want to have hope. She didn't want this to be another failure. And so there was a level of hesitation that was there during our first visit. And we find that all the time. The people that we work with, you listening to this podcast, you probably feel pretty beat up and you don't necessarily have the energy to muster up another doctor visit and potentially get your hopes up and then disappointment to follow. And so what we want to do is actually get to the source of the problem, actually solve this and provide a solution that is reasonable. All right, so what I want to talk about today is the source of headaches or migraines. All right, now what I mean by that, what we're going to do is we're going to talk through our framework. We're going to talk through how we're able to capture, evaluate, and then treat and get people on the pathway to relief with just about any headache or migraine. And we're going to talk about why that solution is so reasonable. Okay. Now, it's not as if like I'm coming up with this on my own and I have some patent on some solution that no one else has. We're just going to talk about basic things like physics and science and how the body should move and what you can do to take advantage of that. All right. So the source of headaches or migraines. Now, in my journey, my story, I started at the Mayo Clinic. So the world famous Mayo Clinic, where people come from all over the world to receive treatment, learn from some of the best doctors out there, whether it's orthopedics, neurology, had a robust understanding of the body coming out of physical therapy school. Now, I latched on to a few physical therapists that really understood the neck and the jaw well, and they were treating headaches, they were treating jaw pain, they were treating neck issues. So I started treating headaches. Now, what I found was that within my first year, I would get patients on my schedule that presented with migraine symptoms. They said, I have migraine as a diagnosis. And at first I thought, well, this is something the neurologist needs to treat. What they said was, I've been to neurology. I've been to multiple neurologists. I've tried the medication and it has not worked. And I know that my neck has some sort of issue. Can we work on my neck? So I would evaluate their neck, I'd treat their neck, and sure enough, their migraines would go away. They'd reduce. They would be manageable. They wouldn't have to take meds. They found relief they hadn't found anywhere else. And that just kept happening. The first few dozen people I saw within that first year found relief from their migraines that they had not found anywhere else. And so what I did was I looked into the research. I tried to understand what are these neurologists using to guide their clinical practice and lead people down the road of medication. And what I found was that the medication was symptom management. So there wasn't any claim that neurology understands the source of these headaches or migraines, which is really a slippery slope, because if you don't understand the source of what's happening, then really you're treating symptoms, which in a world of debilitating symptoms, if we are able to reduce the intensity, the frequency with medication, there's a time and a place for that. But if that's the only solution, that's what's leaving people feeling hopeless, burnt out, frustrated, and like they're never going to actually solve this problem. So seeing that I was getting results over and over again by treating this overlooked problem also made me curious of why is this not out there? I wasn't doing anything that was super profound. I was unique in that I had this training from Mayo, and then I also was able to get exposure to these other physical therapists that were pretty unique. There weren't too many physical therapists doing that. And then I was able to apply it to these patients with like true migraine symptoms, true migraine diagnoses from neurologists, multiple neurologists, all validating this. The other thing I found on the neurology side is that these diagnoses were based off of symptoms. So you basically would say, I have a one-sided pounding, throbbing, debilitating pain that's accompanied by light or sound sensitivity. And they would say, okay, well, that's a migraine, and that migraines respond to these medications. But again, no conversation about the source of those treatments. On the other side, again, I was wondering, why is this treatment not something that's available? Well, there's a few reasons. In our healthcare system, you access our healthcare system typically through a primary care doc. The primary care doc is going to likely refer you to a neurologist if some basic level of medications don't seem to do the trick. Then the neurologist, again, is looking at this through the lens of medication, through serotonin levels, through the chemical imbalances, through, okay, do these CGRP drugs and shutting off proteins that transmit pain signals, are they going to be effective in your migraine presentation, which is all based on experience of these symptoms match this medication, which is what you are going to get prescribed, okay? Now, even in that system, there's some level of acknowledgement that the neck is an issue, and even the fact that Botox is one of the primary treatments and one of the most effective treatments for migraine is indication that the neck has a problem. Because Botox is paralyzing muscle. It's paralyzing muscle tissue. It's making sure it's not allowing the muscle to contract. And it's acknowledging that the muscle tension is a problem. And the muscle tension is referring pain into the head or the face. If Botox is helping, which it doesn't always work, we have a lot of people that Botox really didn't help at all, or maybe it even made things worse. But when it does work, which it works with a lot of people, and that's why Botox is a thing, it's acknowledgement that there's something in the musculoskeletal system that is contributing to these headaches or migraines. Now, the lens that these medical doctors are looking through is really the lens of, if we're going to evaluate the neck, we're going to take X-ray, MRI, CT, we're going to look at a still image, and we're going to take that as like, is the neck healthy or not? And if it's not healthy, there might be like, signs of wear and tear. So stenosis, disc degeneration, degenerative disc disease, things that show up as like abnormalities. They could be normal signs of like your neck, like you're not 10 years old anymore. Oftentimes they don't actually correlate or correspond to your symptoms of headache or migraine symptoms. The parts of the neck that refer to the head or the face are the upper part of the neck. So anywhere from the base of the skull to C3. So the first, second, third bones. Most of the things seen on imaging, the changes seen on imaging, are in the mid portion of the neck. So C4, 5, 5, 6. So if you've had imaging and they look at that still image, they're likely seeing problems in like 4, 5, 5, 6, 6, 7, not necessarily in the upper part of the neck where the problem is. And so they're missing the movement, the dynamic nature of joints, how our head should rotate, nod, flex, and extend. There's so much information that's missing, but that's what they'll take and say, okay, your neck is fine, and so we need to just keep trialing these meds. Now, on the other side of things, sorry, I keep going on tangents. On the other side of things, why wasn't the neck being evaluated properly and treated by physical therapists or even like chiropractic? So chiropractic does step into this space of headaches, migraines. It's not hard to find a chiropractor that will say, yes, we treat headaches or migraines. And I will say that chiropractic can be effective. What happens, though, is people typically say it's short-term relief. So they have some relief, but then they're like right back in the office. So maybe a week later, if you're lucky, it might be once a month that you're going, but you don't really feel like you can ever get away from it. So what's happening there is that chiropractic is largely looking at the spine based on an alignment perspective, okay? So the whole model and framework that they're using is based off alignment or a subluxation model. And so what that means is they'll take an X-ray and they'll line everything up and say, okay, this is how far it's deviating from what neutral should be or what normal would be. Now, there are different flavors of chiropractic. There's ones that specialize in the atlas, and I have seen patients that have had good results with that. And there's chiropractors that deviate from that alignment model altogether and do different types of things. But for the most part, an alignment model leads to the adjustments. So the adjustments can be the activator, the hands-on manipulation. And so there's some level of addressing like the musculoskeletal problem, the tension that's built up in the neck, But ultimately, it's missing the loss of movement or the lack of movement, which needs to be restored. And so there's typically only temporary relief. Okay, so who would do this? Who would provide this sort of evaluation solution-based approach, restoring function to the neck? Well, physical therapy. Physical therapists are trained in how to restore mobility, understand biomechanics, and improve how the body moves. Now, physical therapy is very well known in the rehab space. After you get a total knee, if you get an ACL tear, if you had a surgery and you need to recover, get back to life. But the problem is our healthcare system is largely channeling patients to the physical therapist. So that business model is set up so that they work with insurance, they work with providers locally, oftentimes they're surgeons. And so a lot of what physical therapists will see are post-knee surgeries, post-back surgeries, things like that. Now, the referrals from primary care docs or neurologists, again, will be like low back pain, knee pain. So the lens that the medical doctor is looking at headaches and migraines through, migraines in particular, is this lens of this is a chemical, spontaneous neurological event is the phrase that you'll find online. And because it's a spontaneous neurological event, physical therapy doesn't fit in that. If you get sent to a physical therapist, it's just because they say, you might say, okay, my neck is really tight. And they say, okay, like physical therapy can do some stretches or show you some exercises to help with that. But there's really no thought that physical therapists can treat the actual migraine itself, okay? So what that means is physical therapists aren't seeing these patients, and physical therapists aren't having confidence that they can even do anything with these patients. And they're not being introduced to the types of treatments and techniques that are being applied to the physical therapist or to the patient that we see here to be so effective in our process. And so what happens is these patients never actually get introduced to the right provider being a physical therapist. And even if they are introduced to the right provider, that provider, the physical therapist, really doesn't have confidence or the understanding to know how to evaluate or treat the patient appropriately. Okay, so that's probably been your experience. That's the experience of most of the people that we interact with, is just there's no solution. So this is my journey. I did this research. I tried to understand the problem, and that's what I came to. And so the source of headaches or migraines, any sort of head or facial pain can be a referral pattern from the head, from the base of the skull. Okay, so anywhere from this suboccipital area. So if you're watching me on YouTube, it's just like the base of the skull, fleshy part, top part of the neck. You likely have some sort of pain or sensitivity there. It's not uncommon for people to say like they need to rub there when they get a bad migraine, or that's where it starts. So the upper part of the neck is where I'm talking about. That's C1 and C2 and C3. All right. So we get nodding, we get rotation, a little bit of side bending from those joints in the neck. Now, the mid portion of the neck picks up the slack. So a lot of people don't realize that they can't really turn their head very well, or maybe they feel like they can turn their head fine because they have so much mobility through the mid portion of the neck, or they can side bend. So you don't really realize you have a neck issue, but all along, like the upper part of the neck is really angry. It wants to move, but it can't move. Okay. And so it refers pain into the head or the face. So sometimes we see all types of different, we see different types of migraine symptoms. It's not just pain. So we could have a silent migraine where you get the visual disturbance, the aura, but you don't necessarily have the pain, the pounding, the throbbing, the debilitating pain itself. It's just more like my vision goes, and it's like I can't drive and I have to basically stop whatever I'm doing. So we have the impact on all types of headaches and migraines with the upper part of the neck being the problem and taking these patients through a solution. Now, why would that be? Now, why would the neck send signals to the brain and the brain interpret these as a visual disturbance, nausea, sensitivities to lights and sounds, or just like I have a stabbing pain behind my eye or a band-like presentation on my forehead? So what's happening here? And I can't go through all the specific diagnoses on this podcast. I guess I could, but it would take a while. That's what the other podcasts are for. Essentially, there's a loud, noisy pain signal, and the brain is getting that pain signal, and it's traveling through pathways in the brainstem. So it travels through a peripheral nerve. So it's a nerve like the trigeminal nerve, picks up sensation from the head and the face, occipital nerve from the back of the head, top part of the neck, and they travel through and enter the brainstem at the same point. All those different pathways enter the brainstem. It sends a common signal up to the brain. The brain gets this really loud, annoying pain signal, doesn't know where to attribute it to. And so oftentimes it thinks like the right eye, it's a stabbing sensation, maybe in the temple, maybe it wraps up and around like a ram's horn presentation. Now, each specific presentation of pain does correspond with usually a type of dysfunction or how you carry your tension in your neck or a specific joint that's a problem. But the point is that any of those presentations are sourced back to the neck itself. It's very, very rare. We've been in business for 6 years, seen a few thousand people with headaches and migraines, and we have yet to find someone that their neck was totally unrelated and it was just something in the head. And that's because our healthcare system is good at screening for those things. So the majority of people, 90+% of people that have any type of headache or migraine that's gone on and you can't figure out what's happening, we have to think that there's been an overlooked problem in the neck, okay? So lack of movement in the upper part of the neck. So C1, C2 is not moving. It's really angry. It's sending a pain signal. The brain's confusing where it's coming from. Now, the other thing that's happening in this scenario is that the brain's confusing where it's coming from, and so there's overlap with other sensory inputs. So visually, and then your sense of smell, again, bright lights, there's some nausea. So it's almost as if the brain thinks there's multiple things going haywire because of this pathway and sort of overlap with the brain saying, okay, there's something wrong, and so everything's just going to be kind of sensitive. I use the example of someone in a house that's on fire, and then the alarm smoke detector is going off, and then you have a kid like pulling on your leg. Like you're going to be hypersensitive to like everything. Like everything's going to be sort of obnoxious or annoying because you're stressed out. Like your stress level's so high, like you just can't tolerate it, right? And so the environment of the brain, it's not calm. It's getting this loud, noisy pain signal. Everything's on high alert. And so it's just everything feels like it's going haywire. Even things like brain fog, like limited capacity, diminished capacity for your brain to function and cognitively at a high level. Like you just can't think. You're not productive. Again, your brain's an environment where it's stressed out. Okay, so that's what's happening from the neck. And it's treated effectively, and we see the connection with nearly every type of headache or migraine. So the assumption is your neck has been overlooked, but really we see headache, migraine symptoms connect to the neck almost as if you came in and said, my knee hurt, and we'd look at your knee. It's just a referral pattern, and it's a referral pattern that's so common, and an overlooked neck issue that's so common that it's nearly everyone that has a persistent, any type of headache or migraine that's just ongoing has this overlooked neck issue. And so the other things we look at are the jaw and the shoulders. Oftentimes people have shoulder dysfunction, which is playing into the neck. They have jaw dysfunction that's either secondary to the neck being a problem, or there's airway issues, problems with their teeth, with their bite, with their jaw joint that are contributing as well. The jaw itself, especially if you wake up and you know you've been clenching, grinding, you have temple pain, there's definite jaw issues involved. So we look at things from the musculoskeletal perspective, meaning the body should move in a certain pattern, in a certain way. We know how biomechanics function. We know how joints move. And if they're not moving, we need to restore those. And when we restore those, the body starts to calm down and these symptoms start to go away. Now, there's so many questions behind headaches and migraines as far as triggers and hormones and barometric pressure changes and certain food groups and stress. And so all of these things impact the body's threshold. All right. So here's our framework. Like when you come to us and you say, well, I feel like mine are hormone related, or I feel like mine are because, I eat aged cheese and that triggers it, or whatever it may be, or it's stress. Now, those are not directly causing your right eye to feel like there's something stabbing or like a band-like presentation in your forehead, but they do contribute to it as you are experiencing because they're manipulating or dropping your threshold. So it's something else that's stressing the system out. And so you cannot tolerate this already stressed out brain and neck because you're now also experiencing a fluctuation in hormones, or the barometric pressure is changing, or you've consumed foods that you're allergic to and they have a negative impact on your body. And so threshold and the impact that the different triggers that we experience, impact threshold, are something that we take seriously and consider, and oftentimes even refer out to other providers to help us along this journey. But the actual source of pain itself has to come from somewhere. We don't buy into this spontaneous neurological event, and largely because we've got over 1,000 people that can testify to that their symptoms reduced when we started working on their neck. And when we resolve their neck issues, their headaches and migraines resolve as well. And so we've come to believe that nearly every type of headache or migraine can be a pattern, a referral pattern from the upper part of the neck, treated effectively if we get things moving better. So it's really as simple as that. The body needs to move, we get it moving, and then the symptoms reduce. Also considering someone's overall health, which impacts their threshold. If someone has a super low threshold, they're not going to be able to tolerate much tension in their neck. And so both things often need to be considered through our process. Okay, so this is something I try to go back to in the podcast every now and then because we have new listeners all the time. So if you just hopped on and are listening as they come out, maybe you haven't heard us talk about like the core things that we do and the source of headaches or migraines. And so this was to provide clarity to you and your situation, and then to empower you guys to know that there is something that's treatable. There's something that's actually wrong objectively that can be improved that's very likely been overlooked. We have people from around the country, from around the globe that reach out to us because this problem is not being addressed. And so if this sounds like you, I want you to reach out to us here at Novera Headache Center. Go to our website, noveraheadachecenter.com, book a visit. We have virtual coaching plans, and then we also have in-person care. Either way, you can start virtual or in person with a free half an hour, and we can get you started on our process. Thank you all so much for listening to the Headache Doctor podcast. As always, it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. I'll see you next week.